I'm Kristen with the New England Prevention Technology Transfer Center, which is the host of today's webinar. I have a couple of slides I'm going to share before we move into our main presentation for today about increasing gambling awareness on college campuses. As I mentioned, we are here today funded through the New England Prevention Technology Transfer Center, which is funded through a cooperative agreement from SAMHSA at the Department of Health and Human Services. The opinions expressed in today's webinar are the views of the presenters, not necessarily the official positions of SAMHSA or DHHS. If you're not familiar with the New England PTTC, we are part of the national PTTC network, translating prevention science into trainings and technical assistance to guide the prevention workforce in adopting and implementing prevention science in your communities. We have a wide range of services and products available, including webinars like this one, online courses, other online resources, and tailored technical assistance if you have a specific request. And this is the rest of our wonderful New England PTTC team. I know many of you have probably interacted with somebody on our team. If you haven't found our website before, you can go to pttcnetwork.org and see what we have here in New England. We also have an email address if you want to reach out to us directly. If you're joining us today from outside New England, which I know we have quite a few people, I also encourage you to get in touch with your regional PTTC center. We are one of 10 regional centers, as well as our national coordinating center across the country. We have many resources available, but sometimes there are region-specific resources available too. So I encourage you to connect with your regional center and continue joining our New England webinars too. And then just another note from our PTTC network, we know that the use of affirming language inspires hope. Language matters and words have power. So we strive to use affirming language to promote the application of evidence-based and culturally informed practices. And we encourage you to incorporate this into your own work as well. And then just a couple technical notes. We are in a Zoom meeting format today, so you will be able to turn your camera on if you'd like to have your camera on. It's always nice to see real people out there. And we will have time at the end for Q&A and some discussion, so you'll be able to unmute yourselves or use the raise hand at that point. You can also, we have the chat open. Feel free to put your questions or just thoughts in the chat as we go. If we do have questions along the way, Caitlin and Mallory have offered to answer as we go, or we can have questions at the end as well. And just if anybody, I will be sending out certificates. It doesn't look like we have anybody dialed in by phone. So I will send certificates out to folks. I usually get those out within a week or so via email. So you'll be getting that in your inbox. And I think that's it from me. So at this point, we'll turn it over to our wonderful presenters today, Mallory Schultz and Caitlin Brown from the Connecticut Council on Problem Gambling, who are here today to share a bit about this work that they've been doing and just some information about gambling awareness.
Thank you, Kristen. Let me go ahead and share my screen. And I apologize if you hear my dogs, because they might be barking at some point. So thank you for joining us all today. Just a little bit about us. My name is Mallory Schultz. I'm the prevention manager at the Connecticut Council on Problem Gambling. My background is mostly in substance use prevention prior to this role. And then I've been with CCPG for about 3 years now. So I made the switch over to gambling prevention, and yeah, it's been extremely rewarding. Most of the work that I do is with the college population, so we'll be talking about that today, and I will hand it over to my coworker, Caitlin.
Thanks, Mallory. Good afternoon, everyone. Thank you for joining us today. My name is Caitlin Brown. I am the Senior Director of Programs and Services with the Connecticut Council on Problem Gambling. So I see some of our Connecticut people on here. Thank you for joining us, and also a lot of people from our National Council on Problem Gambling Prevention Committee. So always nice to see you all and some new faces. So if you're not familiar with our organization, we are a nonprofit affiliated with the National Council on Problem Gambling here in Connecticut. And our mission really is to prevent gambling related harm. And we do that through advocacy, outreach, education, and training like today. And we also facilitate the 24/7 problem gambling helpline for our specific state, which provides resources and referrals to anyone who has been negatively impacted by gambling, including family members. A little bit about my background. I am a licensed professional counselor, a licensed alcohol and drug counselor. I also hold international certifications in both gaming and gambling disorder. And so basically, I started my career working with substance misuse and mental health in an inpatient program, moved on to outpatient. So although I don't see my own clients currently, I'm still very involved with helping people access services specifically for gambling disorder and gambling related harm. And I kind of oversee a lot of different things that are happening across the state related to gambling. And so today we're really excited to talk a little bit more about our college campus program. And so because we are offering CEUs today, we'll talk a little bit about the learning objectives. We're going to discuss the current landscape of gambling on college campuses, talk about potential risk factors associated specifically with those of college age, and examine how participating colleges implemented initiative on their campus. And thank you for putting things in the chat. Like Kristen said, please feel free to put questions and comments and introduce yourself. I'll be monitoring the chat as well, and you can interrupt us by coming off on mute if you have a question. So this is an infographic that came specifically from one of our toolkits, which we'll talk more about throughout the presentation. But in Connecticut, college students play safe was a tagline here. And we really wanted people to be aware that we know that college age students are gambling. We know that they're exposed to gambling. We know that they are having maybe their family members or their roommates or other people that might be experiencing some negative harm related to gambling. So we really wanted to just increase awareness, which is how this program came about. So, one thing that we have on this specific infographic is, does my friend have a gambling problem? If so, you might have saw a sign that made you concerned. And so helping them to understand what are some of those warning signs that they should be looking for so that they can hopefully make a referral or help them connect to resources. So all of this information specifically from these slides come from a toolkit at Drug Free CT. Like I said, we'll give you all that information so you can use them as well. So we educate people about what is gaming, what is gambling. So talking about a person gambles when they take part in an activity that risks something of monetary value for the chance that they may win something. We also help them to understand that it might not be for money. So it's really anything of value, and that could be time with your family, with your friends, if it's impacting your grades or attendance. And then we talk a lot about the different types of activities that count as gambling, because many times people will only think, oh, the casino is gambling. And we'll say, oh, have you ever bought a lottery ticket? Or have you ever bet on a sporting game? And they're like, yeah, but that's not gambling. And like, yes, it is gambling. So helping them to really understand what counts as gambling. And so here you can see the types of activities that including in gambling. So we do have casinos, we have lottery, off-track betting, online casino sites, and apps. I will put out here, because I know we do have people from a lot of different states, so this might look very different depending on what state you're from. Here in Connecticut, we did legalize online casino and sports betting back in October of 2021. So it's been a little over 4 years that we've really been able to monitor the impact that that has had on our communities, as well as college students. We have scratch tickets, sports betting, stocks and cryptocurrency, and then helping them to understand what something of monetary value could include. So credit card charges, cash, actions or services, and other tangible items that they might be betting against each other for. And gambling is very common on campus. I feel like this has been a very hot topic. I know when Mallory and I talk all the time, everyone is talking about gambling on college campuses. We even had a meeting yesterday. I know that that came up in conversation. Both of us will be presenting at the National Council on Problem Gambling's Prevention Showcase in July, which this year is dedicated all around initiatives focusing on how to support college students around gambling. So here we have a few statistics that we know that 3 out of 4 college students reported that they have gambled in the last year, not necessarily problematically, but they have been exposed and they have placed a wager. 18% report gambling weekly or more, and about 10% experience problem gambling, which is significantly higher than the national average when we talk about problem gambling being 3 to 4% of the population, and then additional 1 to 2% of the population meeting the criteria to be diagnosed with gambling disorder. So we know that they are at an increased risk. And then we also have a piece here where we tie in about finances, because although gambling is not about the money, we do know that many college-age students and others report gambling as a way to supplement their income, or a way they see it as a way to increase their finances. We know that many young people worry about their finances, and of people age 18 to 34, about 70% of them are reporting that they're anxious about their personal finances. Only 1/3 of people report that they're satisfied with their personal financial condition, and only 1/3 of incoming college freshmen feel prepared to manage their money. So I know that college age has been known as like the perfect storm, right? So you have all this freedom, you're more independent, you have access to credit cards, even if it might only be for an emergency. So this is all new and might be the first time where they're responsible for managing their own finances. And so there are obviously financial risks when gambling. So we also educate people about that, which would be borrowing money to gamble, chasing your losses, making late payments, misusing student loan funds, and then putting off good financial practices like creating a spending plan or a budget and sticking to it. And some warning signs that we help them to understand that if somebody has a gambling problem, you might see this. So if they're borrowing money to gamble, they're chasing their losses, maybe they exaggerate their wins or minimizes their losses, that seems to be a big red flag. If you talk to someone and they say they always win, right? Because we know that that's mathematically impossible for someone to always win when they're gambling. They might feel restless or irritable when they're not gambling or trying to cut or stop. Lying to family and friends or hiding how much time and money is spent gambling, risking or losing relationships, or maybe they're just lacking interest in other hobbies and activities that they used to participate in, seeking help to pay off financial losses, and then spending a lot of time gambling or planning to gamble. And we also know that gambling is linked to mental health and substance use disorder. So gambling doesn't just happen in its own little bubble. I like to say that it's, if you don't know if it's what came first, the chicken or the egg, is someone having mental health issues like depression and anxiety, and then they start to gamble and they feel better, or were they gambling and then because they started to develop a gambling problem led to more anxiety and depression, and it can be both depending on the individual. But we do like to highlight that of people with gambling disorders, about 73% also report having issues with alcohol use disorders. And we also know that using alcohol and other substances are at increased risk during the age of college. And then 96% of people with gambling disorders have also reported having some other mental health concern. The two most prominent are anxiety disorders, depression, and bipolar disorder is what we see the most. And I mentioned in our introduction that we do manage the problem gambling helpline for Connecticut. So I thought it would be nice just to give a snippet of some of the data that we've collected for the year 2024. So here you can see what types of gambling. We ask a lot of demographic information, but not always are they responding to that. It is a free, confidential, anonymous helpline. So we are working with what information they feel comfortable providing in that moment. But I do like to highlight here that for 2024, we had a little over 50% of our calls were under the age of 35. So not all being of college age, but definitely a significantly younger demographic. than what we've seen. I've been with the council for about 8 years, and prior to that, I worked specifically in the outpatient gambling treatment programs, and the majority of my clients were in their 40s, 50s, 60s. I even had a client who was receiving services for the first time at 80 years old. And so we did have an older demographic of clients back then. Now, I think one of the biggest risk factors is that ease of access of online gambling and online sports betting, that people are becoming addicted much faster because of the rapid speed of play. So the silver lining there is that they are receiving help and they're getting into treatment at a younger age. Then no longer do they have to suffer and have negative consequences for 20 plus years before they're getting help. But we are seeing a lot younger people contacting our helpline, and a lot younger people entering treatment in their mid 20s to early 30s. So here we just have a short video that talks a little bit about some of the scandals and what has been going on some college campuses around gambling.
This is easily the most organized buying section I've ever done. Link below to download the Opera browser for free.
This is
the
a
ad
must-have for women over 50. Thrive Cosmetics just released new shades.
Been easier to gamble on sports.
You can bet on the games you want anytime you want.
A 2018 Supreme Court decision paved the way for legal sports betting, now allowed in 37 states and Washington, D.C. But it's gambling in the college sports world that is causing new concern.
We've really normalized the culture of gambling as part of the college athletic experience, both in terms of those people who are athletes as well as those people who are spectators and supporters of athletics.
In just the last 2 weeks, college betting scandals have rocked the two biggest universities in Iowa. Iowa State says 15 student athletes were involved in sports gambling violations. The University of Iowa said a new sports wagering investigation involves more than 100 people, including 26 current athletes from baseball, football, basketball, track and field, and wrestling. In a statement, the school says it is fully cooperating. We have alerted the NCAA of the potential violations, and we have hired outside counsel to assist in the investigative process. And last week, the University of Alabama fired baseball coach Brad Bohannon after reports of suspicious bets involving his team. Bohannon hasn't commented.
We'll make a new bet around every 2 seconds.
The NCAA bans athletes and coaches from betting on games, still with the temptation of easy money.
But life doesn't offer you up to $1,000 back in free bets if you don't win.
Researcher Michelle Malkin estimates the number of student athletes placing bets in the last year is as high as 40%.
With all these promises of free bets and matched bets, makes it really attractive. If they get an early win, they honestly believe that it's really possible to get another win. And so they'll just keep betting with that hope that that next big win is going to come.
The American Gaming Association recently banned sports books from partnering with schools. But for now, campus wagering isn't going anywhere.
Pandora's box is open.
But sports business professor Joe Cobb says the threat of getting benched might make student athletes reconsider placing that bet.
Now with some of these stories being publicized, players being suspended, coaches being fired, that might get some attention that will hopefully deter some people or make some people think twice before they do it.
Clayton Sandell, Scripps News, Denver.
Any thoughts or comments after seeing that video? Feel free to put them in the chat. I'll be monitoring that, or come off of mute. What stood out to you? Yes. Hi, Allison. Yes, it's a huge public health concern. And I'm glad that it's starting to be recognized as such, right? Previously, gambling, we talk about gambling increasing with specific populations, but gambling has always been around. It's always caused problems for certain people. But now we've really had the spotlight shined on it, and which is a good and bad thing, right? So more people are talking about it, but unfortunately more people are being negatively impacted. Ease of access, yes. And so we talk about like early big wins. We talk about the age of onset, right? So for people that might be more familiar with working with the substance misuse population, right? The earlier someone starts using substances, the more likely they are to develop a problem. So same thing with gambling. And so again, introducing it through college campuses in a learning environment where people might not necessarily have known anything about gambling before is an increased risk. With promotion by huge celebrities, it sounds more appealing. Yes, and they do that on purpose, right? And they have like the risk-free bets or no sweat first bet. And so helping them to change some of that language, because if you go back to what the definition of gambling is, right, it's risking something of value. It involves risk. And so you can't really gamble without having any risk. It just doesn't make sense. Also, stories of threats to athletes by angry gamblers who lost money due to their play. Yes, and that's becoming more and more problematic. And the crossover with drinking, drugs, gambling really is telling that we need to integrate problem gambling into everything that we do. Yes. Great. And so these are just a few snippets of headlines from different articles that have happened over the last year. So some of you might have heard about some of this on the left-hand side here. We have Louisiana set to ban college player prop betting. So this was an article that came out back in August of 2024 in North Carolina. They were talking about not banning college prop betting. And I know we have Allison here in North Carolina, so feel free to add anything updated, what might be going on with colleges and prop betting in your states if you have more information. And then on the other side here, this is something that has been going on in Connecticut. Currently, there is a ban in Connecticut where you cannot bet on college sports if you are within the state. But this article just came out last week that Connecticut could end ban on in-state bets on local college sports as a part of a gambling bill. So there's obviously a lot of risks there that people have put in the chat here, right? The risk to college athletes, the integrity of the game, the increase of developing gambling problems, and just the more opportunities of somebody saying this is something that is okay for people to participate in if the college is saying that it is okay. I was actually just talking to someone this morning in a meeting, and we were talking about, I don't even know, it was probably over a year ago now with LSU when they partnered with Caesars Sportsbooks, and all of the college students at LSU got a specific code that was emailed to them, knowing that at least 50% of college age students are not of legal age to gamble, but creating that partnership, which it also encourages the betting. Oh yeah, so Allison said Dr. Malkin's current research is really showing the negative impact of promotions and the frequency those cues or nudges are sent on sports bettors' phones. Yes, and we have also seen that, I'm sure in other states it looks very different. In Connecticut, they are talking about having one of our online operators do push notifications. So not only do you have access to your sports books or your online casino apps 24/7, you're going to get those notifications and those nudges. And what's the psychology behind that of then having to check those notifications, and then the likelihood of you adding a bet in that you might not have been thinking about adding prior to getting that notification. So definitely more to come. Like I said, this is a hot topic. I could talk about this and all of my concerns and get on my soapbox for a million years, but we are wanting to talk about the college program. So feel free to continue to put your comments in the chat, and I'm going to turn it over to Mallory to talk about some of the highlights of our Connecticut program.
Great. So this program, the College Campus Gambling Prevention Initiative, I know Caitlin just spent some time talking about some of the data and the helpline, right? So I think that we saw that shift in the demographic of folks reaching out for help. So this further supported the need for education and resources for this population. So in collaboration with the Department of Mental Health and Addiction Services, we've been working with a number of Connecticut colleges. We offer them up to $5,000 to be doing this work on their campus. So they raise awareness of the risks of gambling harm and promote responsible gambling efforts on their campuses. So here are just some of the program goals, and we'll be going into these a little bit. more in depth in the next few slides. So this might be promoting activities on campus to educate students, improving policies around gambling, or even if they have policies, so reviewing that. A lot of colleges hold screening days or resource tables, implementing trainings, creating campaigns, and then utilizing the 7 prevention strategies for community change. So if some folks on here are not from the gambling prevention world, but from the prevention world in general, you might be familiar with the 7 prevention strategies for community change. So we have it as part of the program. They need to be having activities that fit with under the 7 prevention strategies. So we'll be going through that in a few slides here. So this is the participating colleges for the 2024-2025 grant period. So I recognize a lot of folks are from out of state here, but this is just to say that this was our largest grant period we've had since the start of the program. We had 11 colleges in Connecticut, and then our one outlier is Providence College. They are doing wonderful work in Rhode Island and work very closely with the Rhode Island Lottery over there. And they have a unique issue because to legally sports bet in their state, the age is 18, whereas in Connecticut it's 21. So, you know, almost their entire student body is of legal age to be able to bet on sports. So they've had some really great conversations with administration and recognizing that they need to be doing more for their student population. So here are the 7 prevention strategies for community change. So this is providing information, enhancing skills, providing support, enhancing access and barriers, changing consequences through incentives and or disincentives, changing physical design, and modifying and changing policies. So as I mentioned, we're going to be going through all of these strategies, and then I'll be showing some examples of activities that folks did that fit within each of these strategies. But I'll just say too that there's a lot of overlap. So one activity that a college could be doing could fit under, 2 or 3 of these. They're very broad, but yeah. So for providing information, so this might look like promoting resources for help. So this might, in our state, this is the helpline. We also have treatment in our state, the Better Choice program. So promoting that, the promotion of Gam-Anon, Gamblers Anonymous, self-exclusion, and other safeguard options. It also might look like having speakers. So you'll see here some of that, that college has brought in speakers. So we have here Brian Hatch, who's our local celebrity in Connecticut. He's also now a staff member at CCPG, but he has graciously come to many colleges with me, and he's someone with lived experience. He has the podcast, All In, the Addicted Gamblers podcast. So he goes to college campuses and shares his story, as well as some of the risks that are involved for the college population. There's also Craig Carton. So Craig Carton went to a college in Connecticut and shared his story and his lived experience, and that was a really great event for them. And then just some examples of other things that colleges might be doing. So with some of the funding, they might be purchasing t-shirts. So that was really a popular thing to do with the funding. So the t-shirt might have a catchy slogan about the risks of gambling, but then also has information with, the helpline number or resources for where folks can get help. As well as creating some other, stress balls and other giveaways that will have information for resources for individuals. So for enhancing skills, this might be providing trainings for campus police, public safety officers, residential life, so residential advisors, counseling staff, and this is really to help them recognize the signs of gambling-related problems, responsible gambling guidelines, and then the resources that are available for folks if they're experiencing harm. So This is another picture of Brian and I doing a training for a college this year. A lot of what we do is talk with faculty and staff. So yeah, we'll have from counseling, campus police, maybe health services, student affairs. And then we've also we've worked with the RA staff, both on, Res Life and then also the RAs themselves. So Brian and I, at the beginning of the school year, have went in and trained an entire RA staff for a large Connecticut college here. I think it was like 80 RAs, which is a lot compared to another college where it was smaller scale. It's a small liberal arts school, and I think they had like 30. But yeah, making sure that they're aware of the signs and the warning signs, and then the resources, and where, if they had a student who was struggling and this is a question that comes up. They're like, well, how am I supposed to know? Because again, we know that this is very hidden in nature, but it's really engaging in conversations, and then also, really having active listening skills and really listening to students when they're talking about some of these behaviors. So, and then again, knowing where to send those students if they're experiencing any harm. So for providing support, this might be working to integrate with other campus departments. So incorporating gambling that are already in some of that existing coursework. So some examples of this that we've seen. So we've done trainings for psychology and social work classes. I know Caitlin and myself have done it, but we also work really closely with some of our other partners in the state, whether it's through, the clinicians out of the Better Choice program, or our peers in the state are wonderful and also can provide trainings for those types of classes as well. Again, also with addiction specific courses. The Providence College School of Business have, for the past few years, had a gambling education panel. So our contact over at Providence, he is affiliated with the business school. So that is wonderful news for us that he's having these conversations with that department at the school, because this is certainly, when we think about economics and those conversations, this is a very interesting topic for students. And he, if you're wondering how he gets large groups of people to come to his panels, they often offer extra credit. So he will offer extra credit for students to come to the gambling education panel, and it's usually with their partners in Rhode Island, so with the Rhode Island Lottery, and it's been really successful for the past few years. And then another college in Connecticut, this year, I think it'll be for next year, but they incorporated and integrated gambling into their public health curriculum. So they worked with us to vet some of the information that they're going to be sharing with their students, but it will be covered under under some of their coursework. So for enhancing access and barriers, this might be integrating gambling awareness into campus prevention programs. This could be done through providing information. Like I said, there is some overlap there. But some ways that this, in these pictures at least, that are being done is there's a lot of resource tables that are hosted at the college campuses. So if you all are familiar with Fresh Check, so this is through the Jordan Porco Foundation, and this is nationwide that colleges will do this, but it's basically a mental health screening day. And usually schools will have other vendors there who are mental health adjacent. So we usually go to a number of these events, and we'll have screenings. So I think we'll talk a little bit later about screenings and what we do in Connecticut. But yeah, we'll screen students at our gambling resource van. And then this is just a picture of this past year. We at Southern Connecticut State University, they've held a I Screen, You Screen, We All Screen for Ice Cream event. So with the funding, they have brought in an ice cream truck, and students will be screened for through the Problem Gambling Severity Index. And then there's some additional demographic data that we do collect. But once they complete that survey and that screener, then they'll be able to get a voucher to be able to get ice cream. So it's been a really, really successful event. I think we've screened over 200 students at each one that we've done. So that's a way of really enhancing the access, because we know that folks are not being screened, especially this population as well, being more at risk. So, and then also other various wellness fairs. We do in Connecticut have a wonderful network of other community partners who work with us and work with the colleges. So we work with our local regional behavioral health action organization coordinators to be able to go out and also have these conversations, be a presence, and carrying on the conversation of gambling prevention on campuses. So the next couple slides and strategies, I think that they fit well together in terms of one example from one of the colleges that participated. So for changing consequences, at Eastern Connecticut State University, they held a focus group to assess campus rules and consequences for gambling on campus. And they did this through, they had created a campus gambling committee. And what they found was that they did have an existing policy. So this policy here, gambling including but not limited to promoting wagering, receiving monies for wagering, or gambling for money or property is prohibited on their premises. And so what they did, for an example of changing physical design, is they incorporated signage from that existing policy, so that policy, and they displayed this around their campus. So they had this and I believe in dorm buildings. They also had it displayed on some of their TVs, the TVs throughout the campus. So not necessarily a permanent sign, but it is still bringing awareness to that policy. Whereas, like I said, they recognized and found that students were not aware of it.
Mallory, there was a question in the chat. Allison's asking, is your college committee made up of peer educators or administrators or both? So on college campuses, when they're creating these committees, who is it made up of?
Yeah, so I think it might be unique to each college. So that's not necessarily a requirement from us that they create these committees. I think it's amazing if they're able to find the people to be able to sit together and have a committee. But I think for this specific college, it was more so around the, I want to say it was the wellness department. So they had student workers, they had grad students. So actually the one doing most of the work for this, for the grant, was a grad student herself. So yeah, I think it was made up of student workers and then folks that were affiliated with the wellness department or the wellness center on their campus. But we've also seen, you know, a mix of people, the folks, and I think this came up yesterday in a meeting that we were having for NCPG, is that this is different on each campus and it's unique to each campus. So sometimes we have folks that we're engaging with in the wellness center, but then also in counseling, the counseling center, and or if we just have maybe a psychology teacher who is extremely passionate about this, and you know they want to be doing this work. They've also been the person who's running the grant on their campus. So it's not just one size fits all. I think it's for whatever works for their campus. I will say it helps when someone is well connected and has those resources to other departments outside of their respected one. So you know, for in terms of reach, you do get a bit more. But now I'm on a soapbox, so there'll be more time to be able to discuss that a little bit later. And then modifying and changing policies. So we did have one really ambitious school the first year we were doing this grant. And this is the only time this has happened, but they found that there wasn't a campus policy around gambling. So they submitted a policy to the student handbook that adapted language from their existing alcohol policy, and then just included verbiage around gambling. So obviously this is a lot. This is a bit more challenging than, you know, just recognizing and doing an environmental scan to see if there is a policy. But this is certainly, you know, if you recognize there isn't one, yeah, it's a great question, I think, for people to even say like, oh, is there even one? And then going from there. So now we're just going to shift a little bit and talk about data collection and reach. So for the participants of the grant, we use a reporting tool. So we do have an evaluator that we work with who oversees the tool. But basically they can enter in all of their activities. They can, you know, through this, they're able to measure what type of activity and strategy they were doing on their campus. So this is just really helpful information, you know, for them and also for us on what's working well. Are there gaps as we move forward with the program? And you can see most folks, I mean, planning and meeting for gambling awareness activities, but then usually it's disseminating information through written materials and campaigns or messaging. And in terms of specific populations, so we see that most folks that are being reached on campus are students themselves, and a number of other people that might be reached through this program. If folks are curious about the other box, which is there's an open text box that people can enter information that includes trainings for athletics, alumni, and also grant officers. And we know that this is a really difficult thing to capture as in reaches. And this is likely underreported, but through this initiative for the 2023-2024 grant period, about 7,700 individuals were reached.
So Mallory also talked about a lot of the community engagement that we do when we're on college campuses. We do offer an evaluation, a screening tool that we use. We call it our community survey. So this is just some data from those community surveys. It's not unique to college campuses. So any outreach, health and wellness fair that we attend, we do the same survey and we work with the same evaluator who Mallory was sharing about in the previous slides. So the next two slides, I'll just talk about a little snippet of data from what we have seen. So this was from 2024 to 2025, which goes the fiscal year. So July to just ended June. I think from the previous year, but you can see that 73% of our answers come from college or university events. So the data is definitely skewed heavier to colleges, but it's not only college students. So Mallory, you can go to the next slide. And so Mallory did mention that part of the community survey, we ask a lot of demographic information. We also ask, like, has anyone, like a health provider, ever asked you about your gambling? The majority, I think it was like 80% of them had said no. So again, that helps to show us where the gaps are and hopefully to increase our outreach with medical professionals to start to integrate some of those screening questions. And we do use the Problem Gambling Severity Index. So that has 9 questions that asks in the last 12 months. A lot of different things. Have you been restless or irritable? Has somebody said you had a gambling problem? Have you felt guilty about your gambling? And so this is the scores that came up from that previous year, knowing that the majority of them were college students, but not all. So this speaks to what I was talking about before, that college students are at increased risk. Also, the other demographics of individuals are at increased risk. So we saw veterans on there, the recovery community. So like I said before, 3 to 4% of the population is reporting issues with gambling, with 1 to 2% reporting meeting the clinical diagnosis for gambling disorder, which would mean that you're scoring 4 or more out of the 9 categories here for the PGSI. So you can see that we already have 3 to 7 is at 8.4%, and people that are answering yes to 8 or more questions is almost 10%. So again, there are specific at-risk populations, and we definitely see college as being one of them. And then we talked a little bit about the toolkits that are on here. We're also in the process of developing a few more toolkits, which hopefully we will be launching at that prevention showcase at NCPG in July. But this is another website that is specifically in Connecticut, but is available to anyone. And so I put the link in the chat here, so you can feel free to download some of the infographics that are on there, use the statistics. There's a screening tool on there, so that is free to use for anyone. Mallory, you can go to the next slide. And then on that toolkit, it talks about action steps to avoid the risks. So we are talking a lot about increasing awareness that gambling is not a risk-free activity, but knowing that some people are still going to choose to gamble. So we're not coming in and saying gambling's bad, you shouldn't gamble. We just want people to be educated to make more informed choices around their gambling behavior. So we do have these action steps to helpfully decrease the risks that are involved. So knowing that there's always risks in gambling, knowing the rules, risks, and odds. So helping them to understand the odds of the specific games that they might be choosing to play, creating that monthly budget, never borrowing money to gamble, not using money intended for other purposes like your rent, food, tuition money, set a spending limit when you play and trying not to go over that limit. Same thing with the time limit. Avoiding the use of alcohol and other substances when you are gambling, and then knowing if you have concerns about your mental health, get help before you spend any time gaming or gambling, and then knowing what resources are available for help. Mallory, I did see I'm going to let you answer that one. Did you use the IRB for your survey? Did the college universities have to put through their own IRBs?
Yeah, that's a great question. Yeah, so we found a loophole that if we're a third party, and I think this is actually a really great place when we are talking about this resource van, right? So a lot of the time when we're on the college campuses, we are partnering with our friends over at MCCA. They're one of our local Better Choice treatment providers. So they have a resource van. So we're often on college campuses a lot with them. So if we're there as a third party, we do not have to have IRB approval. We have had some hiccups with colleges. In the past, if colleges wanted to be having the survey done specifically on their campus or bringing in researchers to do that type of survey, yes, they would need IRB approval. But if we're there collecting data as a third party, we always tell them that we're going to do it, or we ask permission. Most of them are totally fine with it, but yeah, that's a great question. And I don't know if you want me to keep talking about the van, Caitlin, or if you want to jump in.
You can talk about the van. Go ahead.
Okay. But yeah, that's basically the gist of it, is that we are so fortunate that we have this van that goes all around the state. It's not just specific to colleges. It will literally go anywhere. But it's really a great opportunity. It's peer-led, so it's led by peers in our state. But so we can be really reaching people from, it's prevention, but if someone is experiencing harm or, they're looking for additional resources, it's fortunately led by peers who can be able to get them linked up with those resources, or, get them into treatment if they really wanted to. They can also voluntarily self-exclude at the van as well. So it's a wonderful resource in our state, and yeah, very fortunate to have it.
And if you were looking at the slides previous, it used to say responsible play the CT way. So it just went through a rebranding a couple weeks ago. So I did put the link in the chat as well. We had a partnership with the Department of Mental Health and Addiction Services here in Connecticut. So they released a new campaign, Know the Risks of Gambling. So we really like that as a universal message, because we are starting to do more work with middle schools and high schools and the recovery community. And so bringing in that responsible gambling messaging is not really appropriate for those who shouldn't be gambling or not of legal age to gamble. Whereas the messaging, Know the Risks of Gambling, really is for everyone. So it's the same gambling education initiative. The van still does the same stuff, just providing different branded material with the same message. So we're really happy. So these are some brand new pictures that some of the events that have happened over the last couple of weeks. And then I think we answered most of the questions in the chat, but if I missed you, please feel free to put it back in there. I know we do have a few moments left, so I did come up with a few discussion questions that if anyone is feeling brave and ambitious and wants to answer any of these, you do not have to answer all of them, but just food for thought. What are you seeing as needs around gambling with college students in your state or in your communities? What has been the priority around gambling education awareness on college campuses? I know that has been a big challenge for us because here in Connecticut, our universities and colleges do priority reports. So we worked with a really amazing college the first year. And then when they set their priorities, gambling did not make the top 3, unfortunately. And so when they had to apply for grants and what programming they were able to do with one staff member at their university, they weren't able to reapply to be part of this program, although they continue to do gambling education events and trainings and include us in a lot of the things that they're already doing. But unfortunately, you know, that priority, there are a lot of other things that people have to worry about. And if you are the one prevention professional or you're the one person who works in the counseling department, sometimes it can be challenging to be also adding gambling in, even though it's not that much more work, right? You're just adding gambling into the conversation because it is related to other things that you're talking about. Any thoughts on integration or implementation? What stood out as we were going through this presentation today that you might be able to incorporate? We know that every state is different, and some states only have one person that does this work. Some have very little to no funding, so you might not be able to offer $5,000 to each college, but is there something at a smaller scale or a starting point that, as we were talking today, stood out to you that got your wheels spinning? And then what resources are available or what additional supports might you need to start to have these conversations with your college campuses, students, and communities? So I'll just leave that open. So if anybody wants to come off mute and share or put it in the chat, I welcome your feedback.
Well, I guess I can ask a question. I don't answer the helpline, but I do the online self-exclusion services in Maine. So I work with the people who are self-excluding from sports betting. And even aside from the people who do self-exclusion, what I have noticed in our small population, it feels to me like the college age students, for the most part, aren't going to call a helpline. Like they are way more comfortable if it's on like a website somewhere, and they by the time they talk to me, they already pretty much know everything because they have researched it in depth on the website. Do you feel that you're seeing a similar thing in the college age people?
Yeah, I can speak to what we're seeing on our helpline. So I would say the same thing. We do have a younger demographic of people, but it's not 18-year-olds that are calling our helpline, but it's parents of college age students. So around certain time frames, like around spring break, or now, you know, the semester just wrapped up, we have a little bit of a significant increase there of parents saying, I just found out my son has a gambling problem. He's coming home for the summer. What can I do? What are some resources? So we definitely see more parents calling than the actual college age student because they are more likely just to go online and find out their resources for themselves.
Mm-hmm.
Is anybody doing work already on their college campuses that they want to share some successes or challenges? Oh, Heather says they have parents calling there too. Yeah.
And I know even, you know, I know we have some folks here who are maybe not yet doing gambling prevention work. But I know it can be hard even if you're doing other substance use prevention in the community setting, building those connections with colleges in your area can be challenging because, you know, the colleges are often kind of operating in their own little ecosystems. So building those connections too. So So yeah, you may be doing this type of work, but maybe are also just trying to connect for other substance use prevention work in colleges as well.
Yeah, someone put in the chat, we're working on a lesson for high schools. Yeah, so that's something that we've been doing too. We don't have a formalized curriculum at the college level or high school or middle school, but there's definitely more interest in people having somebody come out. So like Mallory said, her and Brian go and talk to middle schools, high schools. We have some other prevention specialists that are doing that. So at least it's on people's radar and they're having those conversations, even if it's not in a formalized curriculum, but we would love to see that happen. Some kind of legislative mandate, something that includes gambling in their health and wellness education that they're already doing, because we know we're talking about substance misuse, we're talking about suicide prevention, we're talking about mental health. So just adding gambling into those conversations. So Kansas is working with colleges, plans to welcome back festivities that the schools do when school starts back up in the fall, and we've had some events up to date. Great, thank you for sharing that, Laura. And as you just, as this sinks in, because we only had an hour to spend together, as you start thinking about this, if there are ideas or questions, Mallory and I are available to support you in any way that you can, so you can always reach out to us. Mallory, you can go to the next slide and I'll have you talk a little bit about a couple of events, and then we'll leave our contact information and leave it open for any other questions.
Yeah, so just very quickly, we just wanted to share a couple other ways we're supporting just education and conversations around gambling harm in our state. So we are hosting our first ever college symposium on gambling harm in a few weeks here. And we'll have Michelle Malkin doing the keynote. We'll also have folks talking about data collected in Connecticut specific to college population. We'll have a panel of grantees, so people that participated either this year or past years, and some of the challenges and successes that they experienced being part of the program. And we'll also have someone from EPIC there, EPIC Global Solutions. Liz Thielen will be there to share about how she goes onto college campuses, the importance of also targeting this for women as well, not to forget women, and that, it's a wonderful resource to bring EPIC onto college campuses too. And speaking of other options for college campuses, we're also bringing Craig Carton in September. There is a partnership with FanDuel. So for Responsible Gambling Month in September, we will be bringing him in to a small group, and he'll be talking to hopefully students and faculty and staff, and then also promoting a little bit more of their resource. So Know Your Play, which is, if folks aren't familiar with it, it is actually a really wonderful resource. It has videos and clips that people can go online and really respected individuals in our field. So yeah, if anyone has any questions, as Caitlin mentioned, we're available to answer anything all the time. So please reach out to us. And with that, I know we have about 1 minute for questions. So please do call or get in touch with us if you have any questions.
Great. Thank you so much. This was, a great presentation. Lots of great info in there. I'll put in a little plug for 2 links I just added in the chat. One, the brief evaluation survey link for today's webinar. It only takes a couple of minutes and we appreciate your responses. And also another New England PTTC resource that Caitlin and CCPG contributed to is Against the Odds, which is a prevention-focused graphic novel with gambling prevention messages embedded within it that can be printed out or available as a PDF, as well as a facilitator guide to go along with that. So another resource directed towards a little bit of younger audiences for some gambling awareness information. And with that, we will wrap up today's webinar. Thank you everyone for joining. If you do have questions for Caitlin and Mallory and you can't find their contact information, you all have my email address from Zoom, so you can reach out to me and I can connect you as well. And I will also send out these links to Know Your Play and the other resources that Caitlin shared in an email after this. So if you'll be able to look those up after the fact. Have a great afternoon, everyone. Thank you so much.